everyone, what's up? This is Dr. Charlie Johnson, physical therapist, and in this video I want to share with you an amazing transformation that a member of my private coaching program, the Glute Relief Accelerator Program, recently had and continues to make great strides in her recovery. And I'm just so proud of her for the work that she has put in. Meric, the woman you are about to meet in a moment, was just desperate for relief and looking for a solution to her chronic back, butt, and sciatica pain so that she could get back to work and living life. Literally, she went from lying on a couch, unable to sit for over a year, to boating, playing racquetball, and doing lots of different activities all in the same weekend. And this all occurred within 1 week of a very powerful coaching call that we had together. I'm going to share that with you here in a moment. And I just want to take a second here to share a little background to help paint a picture for where Meric was, what she went through, and what she was experiencing. So a little history for you. I have her case here. So between 18 to 44 years old, Meric dealt with consistent back pain and spasms on and off. And just 2 years or maybe now 3 years prior in 2020, she actually flew across the pond, if you will, from the US over to Germany and had a disc replacement in her lower back performed. And then in April of 2022, she hurt her back and her butt while at work and was unable to sit since due to left-sided back pain and burning pain in the butt. In January 2023, she had a progressive worsening of her condition. She had a facet joint block, a diagnostic block. She felt good for a couple hours, was able to do some things, but then hurt really bad afterwards and has been just, again, in constant flare since. At the end of January 2023, had a second diagnostic block to the joints in her lower back. Again, helped maybe a little bit, but not much noticeable relief. In March of 2023, she had a facet joint block, so a steroid shot, as well as radiofrequency nerve ablation. You might have heard of it as RFA to her L4 or L5 level on her spine. Again, zero relief of her symptoms. And then in April of 2023, she had a steroid injection, another steroid injection to the lumbosacral area of her spine. Again, did not find significant relief. So on the case review that I have everybody submit prior to potentially working with us, just to make sure that it's a fit, she wrote, "Here's what my life looks like. Not working on workers' comp. Walking around my house, standing and walking around, lying on my side to eat, lying on my side or back with laptops. If she's on her back, the laptop, she hangs it from a rope from her ceiling. Standing desk for a few minutes with constant movement and balancing on one leg to take the load off of the painful leg. Walking around neighborhood. Gym. She frequented the gym before January of this past year, but now it just hurts too much to even tolerate the drive, 9-minute drive to the gym. She's just not able to do it. Grocery delivery, church, standing only, pacing in the foyer or lying in the room next to the foyer, sciatic nerve flossing, rolling on a lacrosse ball, foam rollers, massage trigger points in the hips, glutes, feet. Massage gun. Recently had deep tissue work by massages twice a week for 5 weeks. Only relief temporary for a day, and sometimes it flared things up worse. Also tried physical therapy at home and at work and things like that. Forward stretching feels good, can't tolerate any extension. And then a Roxziva light therapy, an expensive light apparently, as an alternative to ketamine. All right, so as you can see, Meric was in a tough spot. And in this video, I'm going to share with you a chat that I had with her so you can see where she was and where she is now within just a few short weeks of joining the Glute Relief Accelerator Program. And just a warning for anybody who is planning to watch this. The coaching conversation I have with her that I'll share with you in the second half of this video, it gets pretty raw and emotional at times. Some would even say like downright awkward, right? Not awkward for me, but maybe awkward for her because I really challenge her. And the reason I'm sharing this, and this is with Meric's approval, of course, is because I really want to highlight how far Meric has come and how vulnerable and direct my coaching call had to be and was with her to challenge and finally allow her to break through her belief system and help her get back to living life and get back to work. So look, if you've tried everything and you've worked with everyone and you feel like you're literally just down and out, maybe lying on the couch or unable to sit or unable to move very well, and you're looking for some hope, then be sure to stick around for this entire video, listen carefully, and pull out the nuggets so you can learn what helped Meric and what helped Meric can help you. Oh, and real quick, as you'll learn in a moment, one thing that helped Meric really get unstuck is what I call an evidence list. And it basically helps you determine if your symptoms are a construct of your mind and or your body. And I chat about this in detail at the bottom of my DIY diagnostic guide. I've created that. I put it together for folks like you in pain looking for solutions. I'm really looking to get to the bottom of your pain. So what you can do is you can grab your free copy, download it for free by clicking that link above. All right, now, so let's dive into it. Let's jump into the interview I had with Meric, and I hope that you enjoy. Meric, happy Thursday. How are you?
Happy Thursday. So good.
Good to see you.
Good to see you.
Thanks.
I can't thank you enough for hanging with me on that call.
Yep, no problem at all.
It's been life-changing.
Cool. Well, first off, I just want to say, thanks for, you didn't have to acknowledge that, but I know you were in a tough spot and I knew you needed support. So, yeah, I was happy to do it, and it's good to have you here.
Thank you. Boy, yeah. Okay, so I made a yummy yucky list.
Cool. Yep.
I actually renamed negative motility and positive motility because this went to a neurosurgeon in Arizona who's been wanting to help me because of my case being so complex and for so long. And it's workers' comp, and I'm in a smaller town. And anyway, so this is what I know. Like April was my injury of 22.
Yep.
July is when I started down this mind-body path because it resonated with me.
Mm-hmm.
So I've had a lot of mind-body work over this, this time period. And Monday, I literally had this therapy session and a conversation with doubtful Meric, the integrated parts of us. And so your call on Wednesday was like, I just barely reassured doubtful Meric that she didn't have to scream out through my butt and my leg, that I would hear her, and then here I'm like trying to so after my call with you, I decided I needed to buy in 100% on this. So that evening I went outside and I first started just laying on my side, pulling weeds, which has already flared me up in the past, but I'm like, there's no structural damage, so I'm just gently, basically I've just been practicing a whole lot of calm the fears, safety talk, etc. And the timing of things was incredible because it was my birthday on Friday.
Oh, happy birthday. Sorry, I missed that.
Oh, that's okay. No, you didn't. You guys, thank you. So I've been able to do away with all of the foam rolling, all of the ball massages, etc. Because I'm when I feel like I need that, I'm like, no, I don't need that. I need to calm my nervous system. And I also have this $5,000 Roxiva lamp. It's a new thing from the Ukraine, and it's basically brain therapy, through your closed eyes, and meditations and stuff like that. But you're being frank with me about buying in was really the game changer, and me starting to just okay, there's probably not a micro tear of some sort, injury, So this is part I'm really excited to tell you about. So I did some gradual stuff where I'm kind of scientifically okay, I know this is safe, but this hasn't been safe. So let me just do this one thing, So but then including a friend drove me to the gym. I played 8 minutes of racquetball, and or maybe that was even before our call and then I did 20 minutes of racquetball, and I'm just this is not structural, I wouldn't be able to do all this. I had a structural injury anyway. So, and then basically where I'm at now with almost daily hot yoga, and adding back just lunges for the day, adding back just twist, adding back some gentle back extension, but not all of it, stuff like that. Friday, Saturday, and Monday, I went boating.
Oh, cool.
Cold River, wakeboarded, surfed, kneeboarded.
Good for you.
I'm just this is so much evidence, brain. Look at this evidence that I'm safe, But I feel driving is 100% safe now. I don't even get the clenching. I don't have to modify anything with my driving. besides just reassuring myself I'm safe.
Yeah, yeah.
And I'm sitting on all my furniture. I'm sitting on hard surfaces. I'm like, it's incredible. It's just like, I wish that there was an easy way to convince people that this is legit. I try to tell my story and I'm so passionate and they're just like eyes glassed over, or they'll be like, yeah, I've always thought like there could be something structural because I'm so fit.
Yeah, yeah.
Because activity has always felt good.
Yeah, yeah.
For the past 13 months, besides before that, I have been active.
Yeah.
I'm strengthening everything that I can. So
Yep.
where I'm at now is that I still feel like I definitely have fear of injury for
Yep.
things like weightlifting. Like
Hmm.
Monday, I went to a class and I didn't really want to go to this group class with a friend who drove me.
Yeah.
And I could tell that I was feeling that fear of injury, even
Yep.
just like 10 pounds, and so I exited myself to go just play racquetball, just got myself out of that flooded, I'm safe,
Yep.
and that was really exciting
Good for
because I
you.
never had a flare up.
Yeah. Cool.
And then, but I like, as far as work goes, like, I feel like I'm going to go in there and tell workers comp the miracle. I'm going to give them your website. I'm going to like, this is my story. And yeah, I'm sitting, but I'll be honest with you, I'm still working on fear of injury with patient care.
Yeah,
But
yeah.
now that I can sit like a normal human being, like I'll work some other job that isn't patient care.
Yeah,
You
yeah,
know,
yeah.
I need to know the best link to send to people who I'm like, this is what's changed my life. Like,
Yeah.
like these are all the things that I know have contributed and helped me along the way. But like literally, this was the game changer. Yeah, you could share any of what we just talked about with anybody today.
I could. I could.
Yeah.
Okay.
I just like you, I want to help change people's lives for the good. Like what I've been through, like let it not be for naught.
Yeah, yeah.
Like not only like that I can be one person having my life back again, but if I can help other people get their lives back,
Yeah.
totally, I'm there.
Before you started this process, you tried so much stuff, right? And so can you just can you share maybe a couple of those things? You don't share all of them. A couple of those things, right? That sort of led up to you joining program.
Yeah, for sure. I've been trying to like sort it myself to just like put it all together and well, first my injury was April of 22,
Mhm.
and workers comp put me through eventually the chiropractic physical therapy route.
Mhm.
I did 30 visits of physical therapy and 12 chiropractor visits, a few massages, but at that point I couldn't, I was so flared up, like even just the drive 9 minutes to go to these places was just, I was just in like intense pain basically
Yeah.
for 12 months until I started using marijuana.
Yeah.
And then having like using the marijuana was enough to be like, oh, like settled on my nervous system, I think, with the like, oh, there is some hope that I might not hurt one day again.
Yeah.
But
Yeah.
also in that journey was the mind body route that started in July of the Nicole Sachs,
Hmm.
led me to the John Sarnos book,
Yeah.
and then did a program with a lady in the UK, Carrie Schultz, I think, and
Okay.
then we did, I think it was February, and I've also had the nerve ablation
Yep.
and steroid injection into the S1. But then that was like January, February, March, April between all of those. But February, I started with a guy who did core walking, and then and like mentally too, I eat healthy. I did like all this testing for both hormones and guts and basic thyroid, like rule out everything that could be flaring me up and keeping me revved up, right?
Yep.
Reading books like the drama of the gifted child and body keeps the score, and I
Yeah.
don't know, I can find my books, but
A lot of books. Yep.
things that also would just be like, okay, it resonates with me, but
Yeah.
how
Yeah.
do I fix it?
Yeah. Yeah.
And then trying to think what else stood out. Oh, this light, that Roxiva light.
Oh, yeah. Yeah. Yep.
Joe Dispenza too. I've
Yeah.
listened to a lot of Joe Dispenza stuff, trying to literally just like rebuild all of the cellular level stuff
Yeah.
that I
Yeah.
think was an injury somewhere in that left sacrum hip
Yeah.
area. I don't know. The hot yoga.
Yep. So let me ask you this then. Where did you feel most stuck when you, because there was these different programs, books, readings, right? Like they're part of your journey, right? So you started, right, probably unknowing to certain types of approaches or things, but then you learned a little bit, then you learned a little bit, then you learned a little bit, then you learned a little, right? But like probably if you knew everything, right, or you felt like, oh, I've got this figured out, you probably would have not joined the program, right? And so like, where did you still feel most stuck? We were like, was it that you had all this knowledge, but you weren't really sure like what to do with it? You know what I mean? Like, where were you most stuck?
I was most stuck, I think, feeling like perhaps because December, I went on a trip and I was able to sit on an airplane and I was like, I couldn't, like, there's like, I wouldn't be able to sit on this. Like, why is it that I didn't hurt on that trip? You know, I was
Yeah.
like to Salt Lake to see the piano guys. It was like, and I'm like in the stadium, like, I can't believe I'm sitting here, you know, like it was,
Yeah.
but then January 3rd, I had an
Mhm.
injection of lidocaine
Mhm.
for 2 hours. Just, I'm like, look what I can do. You know, I'm doing like all of the physical therapy stuff, the kettlebell swings and the kettlebell squats and all of the physical stuff. And I'm like, I'm shooting hoops and I'm hitting the racquetball. And I'm just like, man, this is awesome, you know, that I didn't hurt. But then I was flared up so bad after that. And so I did feel like ever since January, it made sense to me because that sciatica had gotten so much worse in that left side, left leg, that I felt like that there was like possibly an injury during that 2 hours. And my conversation with you was the turnaround on that one, because I kept hanging on to like, it makes sense that I could have re-injured something in there
Mhm.
during that 2 hour January 3rd episode.
Yeah.
And
Yeah. Yeah.
then, but I was vulnerable with you about like, and I'm scared, like workers' comp could tell me on June 19th, you know, go back to work because you look like you should be able to sit just fine. You're making this up in your head, you know,
Mhm.
but I'm like, I can't freaking sit. Believe me, like I try and it hurts, you know, like it was
Yeah. Yeah.
literally real.
Yeah. Yeah.
So being vulnerable with you about like, I don't want to like lose workers' comp and then I don't know what job to do that doesn't require sitting.
Yeah. Yeah.
And
Yep.
you're like, you have to buy all in. And I'm like, okay, God's going to help me figure out how to come up with income if workers' comp drops me off.
Yep.
And then, you know, how many days later I'm sitting.
Yeah. Yeah.
Now
Yeah.
I'll do whatever job is out there, you know, like it makes a difference to be able to sit to do a job.
It's kind of important. Yeah. So look, that was a really difficult conversation that we had, right? And so you were actually still at that point. That was again like a week ago, right? So you were like, you showed up to the call laying on your side, right? Because I know you can't sit, right? And so what do you think was the real turning point during that conversation? It was like, wow, that was like really impactful. I know it was tough at the time, no doubt, right? But like, what happened? What happened, right?
I felt like I trusted you already and trust the process, right? You know, like
Yeah.
I felt like I had enough trust in there that, and then trusting God too, that like, I'm going to figure this out on the workers' comp cutoff thing, that, that I think that that was just like, it was like, just trust, just let it go
Yep.
and trust.
Cool. Okay. Yeah. Some people think that's like not legit or that's like woo woo, right? What would you say to anybody who's like, wait a second, what just happened? Charlie had a conversation, right? Because the truth is this, right? Like you had some weeks before then where it was still like, right? Low energy, right? Just like, just really struggling, right? You're in a tough spot, no doubt. And then like, I mean, you're like new person this past week, right? And so, yeah, how would you describe like anybody who's sitting there being like, no, like that can't happen, that's weird, right? Like what would you say to someone?
Well, I already do. And I just get like, you know, like, so I feel like I have to be careful. I'm still trying to figure out what to say to people because our culture doesn't believe stuff like this.
Yeah.
Or they just think that it's just mind over matter and willpower. But no, it's got to be a scientific approach to reintroducing those little things while you're doing all of the calming,
Yeah.
safe stuff. Because because I have been active for 13 and a half months, knowing that I would rather be active and pay for it at home when I try to sit or when I stop being active than to not be active. Right. And so physically I was already like ready to be active, but now I mean, my difference in mindset too is just that I don't have pain like I did 7 days ago.
Yeah.
Like where my pain was like daily between like 5 and 7. It might wake up as 0, but by the time the day goes on you know, like I was just in like high pain for 13 and a half months.
Yeah. Yeah.
And so it's, what would I say to people? Like, if you want to just like keep on doing what you're doing,
Yeah.
do it, you know, like you're gonna learn something as you go, but the faster you can just like trust this process and let it go, and
Yeah.
you know, like, yeah, I don't,
Yeah.
everybody's gonna find their own answers in their own journey, but I'm so grateful that I've just decided enough, kind of like enough is enough, but I think I'd already done that too. But I don't know, this is just like total game changer for me.
Yeah, really cool. Yeah, and I think that speaks to like the power of belief, right? So it's like you had trust in me. Obviously, you wouldn't have started working with me, I hope, probably, right? But you had some trust in me, right? You're like, okay, you're learning some stuff. And you're like, okay, really cool, neat, but right? And you had the yeah buts too along the way. In fact, that was like our last conversation, was essentially, right? You kind of still objecting, like, yeah, but what about this? And so we kept hitting it a little bit, right? And then it was we cracked it, right? And I honestly, like on that call, I wasn't sure if we got to where we wanted. I wasn't sure if we like, wasn't sure if we peeled back enough layers of the onion, but I didn't know if you could take any more, and I didn't know if I could take any more. So
I
we're
was
both
pretty
like,
grumpy and
it's all good. So, but the power of belief, right? It's like, hey, I want to trust this thing, but you were stuck, right? You were stuck with this belief that like your hamstring, you know, had these tears and like the structural thing. Again, you were even applying some of the, if you want to call it mind body, you were applying some of the Joe Dispenza techniques, right? Of meditation. He helped heal his spine, right? Through different meditative practices and visualization. But you were trying to fix these structural things, which maybe weren't as structural, right, as we once believed. And so when you were able to kind of have that aha moment on the call, shift your belief from one of maybe a bit of disbelief or not so sure to like, hey, this is what I said to you. Like, if you're practicing some of these different techniques, right, and you're doing some of the work on the psychology side of things, the mind side of things, you're trying to reprogram this thing. If you don't believe it, it's not going to be effective, because you're going to call kind of you're going to call yourself out. You're going to say, yeah, but no, this, you know, but you got that, right? And you took it to heart. Again, I wasn't sure that we actually got to that point, right? But you did. And so I'm super proud of you for that. But the power of belief, it's like, hey, not really buying in, struggling, and then just being like, okay, cool, trust the process. Like, I'm an open book, bam. And then in a week's time frame, like being able to really turn it around. Again, like a whole different person.
yep.
Really, really neat. And so what do you think, right? Was it the coaching call and kind of us going back and forth that really helped you kind of pull everything together?
100%.
Okay. Yeah.
Yeah, it was literally that coaching call when you were willing to be like frank with me and like tell me what I needed to hear.
Mm-hmm.
And not just all of the empathy and all of the like, yeah, you probably do have something wrong, you know, stuff that other providers have like what we talk about, like the narrative, you
Mm-hmm.
know, and yours
Story.
was like, okay, all right, I'm ready to go all in. And I would have never guessed it would happen so fast.
Yeah, it's cool, isn't it?
It is.
It's weird. It's weird.
No, you tell me how to explain it to these people that are like, what? You haven't sat for 13 and a half months and now you're doing all these things and sitting too?
Yeah, yeah. And so it was, I mean, I don't know if you'd say overnight, but I mean, it was pretty quick, right? Where, I mean, you went from having, I don't know, 13 months, right? Kind of like you can do a little bit, but I know you were like, your friend driving you to place all over the place, right? Like driving you to the gym, driving you whatever. And obviously now you still, you know, you still are working into it. But I mean, you've been sitting now with me for, I don't know, what, 45
Yeah,
minutes,
my
something
sitting's unlimited now.
like
And literally before it was like, okay, 4 minutes and I would, or 60, if I drive like 60 seconds and I'm clenched up, like 1 week ago, that was my life.
Yep.
And now my life is like, oh my gosh, like I'm not even clenching up. This is so awesome.
Yeah, really neat. Cool. Yeah, and you're doing stuff, right? So I know before you could be somewhat active, but you would always have this flare-up reaction, okay? Where like, I know you're super frustrated. You're like, hey, I want to play pickleball. Was it pickleball?
Racquetball.
Or shit, I screw that up every time. I screwed
That's
that up last week
okay.
too. Racquetball.
Racquetball's old fashioned.
It is kind of old-fashioned.
But
I
I like the
remember.
box. You don't have to chase the ball. You just let it keep bouncing. It'll eventually come close.
Yeah, I remember that was more popular when I was even growing up, because I remember even playing like wall ball with those racquetballs, you know, where people throw them at you and you got to touch the wall and you got whatever. Either way. And so racquetball, right, where you do that and then you'd have like this massive flare up. And so it was like, well, dude, I want to be active, but like, I wonder if I'm just like keeping myself from getting better, because like I can't even play like 5 minutes of racquetball, right? I'll feel okay while I'm doing it, but then I'll have this delayed onset of pain, right? Which we kind of helped you understand why that happens. But you've been, you just went, yeah, I think you went boating, wakeboarding, and something else.
Yeah.
I don't know this best.
Boarding, surfing, kneeboarding.
That's good.
Friday, Saturday, Monday, which was all the more like, see, you can't do stuff like this if you have a back injury or a hamstring tear or anything else.
Cool.
It was just
Yeah.
reassuring my brain, like the source of the pain is here. It's legit real pain, but it's not from here. So let's fix it here.
And that's hard to describe to people.
I know it is.
I have people hang up on me, you know, when I start talking about this stuff. They're like, dude, I thought you were going to help me. I'm like, okay. So I get that it's not easy to explain to people. Yeah, your mind, right, can essentially create any pain in the body. Body is instrument of mind. Maybe that's one way to think of it. Okay. And so, yeah, it is possible for anybody watching this, right, that you could be like experiencing some type of symptoms in leg or butt or whatever, but it might not be like that what you think it is.
Yep.
Weird. Now, like, did you believe that though? No, you were arguing with me.
Well, I believed the concepts of it for the other, like a lot of pains in my body, the ones that I felt like were chronic, but this like hamstring attachment one, like that was the one I was hanging on to that I couldn't let go of. Like, it just makes sense January 3rd that I re-injured something, because, and the intensity of that burning in my left glute, that was like the symptom at my patient care injury on April 12th, 2022, was searing pain in that left glute that I've had every single day since. So that was hard for me to believe that there wasn't something structural.
Yeah. So it's like it made sense in other areas, but then it seemed like this high hamstring pain or this sit bone pain or whatever there's like, I get it for other things, but I'm telling you, this is not that. It was like that feeling.
For sure.
Yeah. Cool.
And then that's the one that I had to let go of last Wednesday and buy into. All right, let's test that being mind. And it turns out it was.
Yeah. And so what's really cool is that sometimes what I tell people is the fixing is in the doing. It's like, fine, even if you can't buy into it, can you just practice some of the concepts, right? And then we can see, right? But you're right. Nothing works without some belief to support it. And this is where people get really, really stuck and they get in their own way. And it's like, they're banging their head against the wall. How can we help them break out of this? Right. And so what we try to do is we try to collect evidence. You just mentioned that, hey, I like went boating. I went kneeboarding and I did it, I don't know, whatever, Friday, Saturday, Monday or whatever. Right. And so that was even more evidence. Hey, I had a safe experience. How is it possible my hamstring is being pulled off of my bone if I did those things? That doesn't make sense. And so when you start to have these weird experiences, it usually means they're wired. And so then it's like, how do you take that knowingness, right, and put it into something that you can actually tangibly grasp onto? Yeah, it's just like trying to give you some actionable things and strategies so that you can try them on, right, and start to, yeah, essentially like reprogram mind, rewire, right, response or reaction to it, versus just like feeling the symptoms. Yep, see, did racquetball, must be this, must mean this, and then just like being down and out.
Yeah, that's the systematic approach to reintroducing things and stuff like that, I think was a really big game changer for me too. I just did mine on fast forward. Like I would do like an hour of this and avoid this, take an hour break, and I would know that I didn't have a flare up. So then that was already like, oh, I'm safe, and then like multiple times a day, I was trying like the next step.
Yeah.
Which is part of why it happened so quickly for me, because I wasn't muddying the waters like I had been for all those other months. It was that scientific, okay, I'm just trying this, sit with it. I'm fine. Awesome. How about let's add this? Awesome. How about let's do all of life now?
All right, third one. Awesome. Screw it. We're just gonna do everything, right? Good stuff. But I think at some point you can get to that, right? But it's just like requiring a systematic approach in the beginning, because if you don't, then you're just flaring yourself up, and or you're not sure about what's working or what's not working. But you're right. Once you collect enough evidence, and once you're able to convince yourself, because you have the belief and you buy into it with conviction, because you've done a good job of systematically introducing things, right? Where you're like, okay, I'm safe. Okay, this is actually what we're dealing with here. I'm good, right? And then you can kind of like go do what you want to do.
Yeah.
Yeah. Very neat.
Thank you.
No problem. You did a great job. I'm really proud of you. Really proud of you.
Thank you. Well, I can't thank you enough, but I can pass on your name to everybody else who wants out of their pains. I just apparently got to keep plugging through some videos.
Well, you've got to keep testing, right? Even if you just want to watch Scientific Method in 8 steps.
Testing is different though with delayed response. Like
that's okay.
Like, it's okay. Like that's the part. I don't know. I think I have to sit with this because I don't really know where to go from here besides jump at what you're saying is phase 3 that I'm entirely unfamiliar with. So I'll start there.
Well, yeah. So at the end of the day, yeah, I don't think you're, I think it's a process, right? And trying to, like have all the answers without going through the process is going to be a little bit difficult, right? You have delayed symptoms.
Process since July of last year.
Yeah, I know. But as far as like this process specifically, right? But I get it. Yeah, it's tiring. You're going through a lot, right? Like fatigue, yucky. I get it. Not feeling mobile, not feeling healthy. Yeah, it's no fun for sure. All right. But as much as I'd love to say like, hey, here's the absolute answer this second, I think at the end of the day, what I've found is that most people need to come to their own conclusions, because when I've tried to just spit something out there, it's not enough for someone to have enough conviction. And usually what happens is people are like, yeah, that's great. And then like 5 minutes later, they message me and are like, yeah, but. And it's like, okay, it doesn't matter what I say. Just tell me what to say. Just tell me what it is. I told you what it is, but I still don't believe you. And so then it's like, then it's more about your belief than it is my belief. And so at the end of the day, if you have delayed symptoms, you have to ask yourself, what does that say? 1 second, maybe. So what does that mean? Right? Hold on, maybe.
Yeah, I mean, I guess I'm like fast forward to okay, if it's delayed symptoms, then what? Like, why bother even with all the retest stuff? Hi, cutie.
That's my daughter. I don't think it's a why bother. I think it's you just have to.
It's so stressful for me to do all the testing, even just like literally, I would be just about as successful like pulling numbers out of a hat. It's part of why I quit physical therapy after 30 visits. The indexes and it's just, if I'm like literally hurting like a a 2 during some hitting the racquetball around, but then 2 hours later or whatever, when I've sat home and drove, there's so many variables in it. And then I'm hurting like a, 8 out of 10. I'm on ice and feel like I need narcotics or marijuana, like to settle it down, because I can't settle it down, like.
Yep.
I don't want to do a program that's just constantly stopwatch on how much, okay, I sat for 6 minutes now, and how did I feel after that? And a whole entire Excel spreadsheet worth of things to fill out. No, I don't think this, I've just been revved up over the process, that I'm just like, well, maybe I haven't watched the right video. I mean, I get a lot of, I don't know. I feel like I'm embarrassed to even be on this call right now. What I'm hearing you say is it's okay for me to play all the things I want to play. Who cares if it's even a hamstring, something that I just keep re-tearing and re-tearing and re-tearing. I'm just going to keep re-tearing it.
What evidence do you have to say you're re-tearing it?
What evidence?
Yes, other than pain.
100% of my days, 100% of every day since April 12th, my left sit bone is on fire from.
I understand. Yeah, from something. So that's the key point, right? So if I was to tear your muscle off the bone right now, do you think you would feel it right now?
Yes.
Okay, but how come then, if you're tearing it, re-tearing it, re-tearing it, re-tearing it, you don't feel it until later and you don't notice it in the moment?
I notice things in the moment. Like I said, it might just only be like a 3 because I've had all of the other dopamines and everything else that's supporting me, like making it worth it, or I'm babying it, or I don't know, that like I said, it's why I feel like this is all in my head and I want to fix it through my head. But I also thought maybe I need to make sure that I'm not just keeping my injury ongoing and ongoing, because I'm like, activity feels great, I'm going to be active.
Well, again, I think it comes back to this. I think where you're stuck is just doubt. And so the question becomes, is like, how can you get over the doubt? Right? You're jumping back and forth.
Doubting that it's 100% brain?
Well, just doubt in general, right? So like, it's jumping between the doubt of structural brain, structural brain, structural brain. It's causing you a lot of stress, right? I can see that. And so generally for someone who has, say, a hamstring that's being torn or being whatever, right? Like, activity doesn't feel good for them. They say, dude, I can't do activity. Like, it's painful, right? And so again, I'm not trying to tell you it's structural or it's not structural per se. I'm just trying to help you look at all the evidence, right? And so it's like, at the end of the day, we want to get to the solution, but the only way that I know of, Meric, to get to the solution is to get to some type of answer that makes sense, is to follow a scientific process. Because the alternative to not testing things and not following a scientific process is random, right? And I'm not sure our odds of solving this, doing something random, are going to be very high. All right. So I don't wish anybody have to go through the whole spreadsheet, right? That's not the goal. Has it happened? Yeah, it's happened. Right. But it's happened for a reason. People see it as failure, but I just see it as feedback. That lady who went through all motions, she went through 62 motions. You're like, oh my God, that's crazy. Only until 62 motions did she say, you know what? Something's weird here. Nothing's working. It's not working because it's not structural. And that's why no motions work. You're telling me I had to go through all those motions to prove to myself that it was not structural? Yeah, because that one piece of evidence of being like, well, maybe it is something, maybe it isn't, right? And the lack of response to motion then pointed to and highlight the fact, like, okay, and it tipped her over the scale. And then in 2 weeks, she went from 5% better. She went 8 weeks, 5% better. And then in 2 weeks, between week 8 and week 10, she went to 98% better. Now she's 100% better. Right? So how is it possible someone can go all that time and see nothing, and then in just a couple weeks, right, see massive change? The one thing that was holding her back, right, and wasn't allowing her to respond to either end of the spectrum, brain or body type of approach, is that she just had so much doubt. She could never settle on, so she was always like trying to overthink it. And it was just stressing her out all the time because she was like, hey, it could be this. Well, maybe it's not that. And well, maybe it is, maybe it isn't, right? And just she flip-flopped. What is going to erase the doubt? Right? So the result of doubt is just like this fear and this worry and this stress and this anxiety about process or doing things or whatever. The only thing that can really eliminate the doubt, like the opposite of doubt is caused by just unknowing or not knowing. I'm not sure. And so the only thing you can get rid of doubt that I know of is like certainty and knowing. But the only way that you figure that out is by going through a bit of a process. And so like this stuff is tricky. I wish I could say it's really straightforward, but it's not. Some people it's going to be more straightforward than others. Other people, they're going to battle with it, right? And so the question becomes is like, if you look at the evidence and all the evidence that you have right now, and at some point you need to make a call, right? And say, okay, I either believe this or I don't. And if you don't, that's okay. But then you need to identify the source of doubt. Is it that I don't believe it because biologically, there's usually three things. Biologically, I'm just wired to believe that this physical pain, there was something I did that injured it, and that's the reason, and boom, boom, boom. Physical pain is always structural. That's just, we're humans, and that's the way we think. Is it that you have, again, maybe some type of image findings or some type of anything else? It doesn't sound like it this time, right? So that's probably maybe not it. Or for you, it could be the lack of image findings.
Yeah, because of my artificial disc, my images are just black.
Yeah. And so like, I just to help you out the most, I just want to figure out like, where do you feel like you're kind of ping ponging back and forth? Like where are the yeah buts coming in? So in one moment you'll talk about like, I 100% buy in. And then the next sentence you'll be like, hey, what if I'm tearing my hamstring off the bone, which goes back to structure. You see what I'm saying? So like there's something there that is like keeping you from committing to something. What piece of evidence would be needed for Meric to either refute or not? What would that look like? Or like, where is the sticking point?
I feel too confused by your question. I'm sorry. If you're asking me a question, I don't even know what you're asking.
It's okay. It's okay. You're torn. On one hand, you talk about like, I'm totally onto the brain stuff. Like it's making sense, whatever. And then the other sentence, you're not.
Yeah, because I think that there's multiple things going on with my injury. And
cool.
And so like I identify as being a chronic pain patient, and because I had, but like I had like incredible my back surgery is still incredible. I've yet to throw out my back ever since my back surgery.
Yep.
I'm just now struggling with this sitting thing since April 12th, 2022.
I get it. So
I
then go ahead.
I don't know how to answer it any differently. I feel like I'm giving the same answer over and over. Like,
it's okay. It's a little cyclical. That's all right. Don't worry. We're going in little circles. I'm okay to go in circles though. So yeah, what I'm trying to say, right, is that you'll have a difficult time responding on either end of the coin to treatment if you're kind of flip-flopped all the time. If one day you're like, oh, I think this, and the next day you think that, because what'll happen, you'll practice, but at the same time, you won't authentically be doing it because you'll be like, yeah, right. I don't actually believe that fully. Right? Like if somebody's sitting there right now and they're like, I know I have a disc problem, and like, there's got to be something, like when I bent forward, like it went out, it hit this nerve, and I know I have that problem, or like, I think that's really the problem. Then they're going to be sitting there trying to, what are the 3 stages? Mindfulness. Everybody can do that, structural or not, and be successful. Just look at your symptoms. What's happening? They're in my butt and they're spreading, or they're shrinking, or they're doing this, or they're doing that. Great. Okay. Now you got to reappraise it as safe. Yeah, bullshit. You believe there's a structural thing and that the pain that you experience is your hamstring pulling off the bone. You can't say that's safe. Your brain's going to say, no way, not safe. So you won't respond to it because you can't reappraise it as safe. because it's impossible to view your sensations through a lens of safety if you feel that the pain that you're experiencing is actually due to physical harm. Your brain's not going to let you override that.
Tell myself that I'm healing.
Yeah, but do you believe it?
I use the verbiage that is believable to me is that I'm healing.
But do you actually believe that?
Yeah.
Is it
100%.
believable?
Oh yeah.
Okay. Is it backed by objective believability? Like, would you say you're getting better?
One, I hate the word better because it's subjective. It's in itself, or subjective, whatever the word is. Like, I don't know how to answer your question.
That's okay.
I feel like I'm better every single day, but if you were to take like better than what, I'm better every single day in something, even if it's just my coping capacity,
I'd say, like, are you moving closer to becoming more functional, being able to sit longer, like do that what you want to do better?
No.
So then I would just say, like, even though you're saying I'm healing every day, are you healing every day? Like, is that a believable term?
Piece. If there's 100 pieces and you're only, like, I feel like my response right now is just like hang up this phone call.
You can if you want.
I'm proud of myself that I'm staying on it. I'm giving you a chance. Like, I don't think it's helpful to me though to be quizzed like this. Like, what's the right answer? Like, what answer am I supposed to give you to like end the conversation for one, or move to the next step, or what is it you're asking for? What's the right answer?
So I'm not doing it to trap you, so I apologize if you feel that way. I guess what I'm trying to do is, like, I'm just trying to coach you through the process, because I see that you're stuck, right? You're stuck and you're torn ever since the beginning of, like, hey, I have this trouble sitting, and so I have like this hamstring thing, and it's like here, and like I want to be active, but like I don't really feel pain when I'm doing things, but I have delayed pain. And so then we filled out evidence list. What I'm trying to say is just like, what is holding you back? That's really what I'm trying to identify, Meric, as far as like, what is keeping you kind of tied, if you will, to, or torn. It's this or it's that. And what can we do to bridge that gap? Because that's really what's going to need to happen. If you live in limbo of like, it's this or it's that, or it could be, or whatever, it's going to be more difficult for you. And so it's like, what do we need to do to fill in the gap to give you more clarity, I guess?
Right? Okay. I'll be totally forthright and vulnerable here.
Yeah, totally.
I feel like it's workers' comp that's keeping me trapped.
Okay.
Because on April 11th, I could work just fine as a nurse, $50 an hour. Mm-hmm. On April 12th, when this happened, and it totally traumatized my life and took me back to everything pre-surgery.
Yep.
And divorce and a devastating mediation that even sent me to have to work full-time as a nurse. And then I'm down to $30 an hour of lost wages. I've learned how to live on that. It's fine.
Yeah.
But then my workers' comp doctor, he uses verbiage like, well, if you lose your workers' comp's benefits, then we can still try this procedure, this injection, this or that, because in his paperwork, he's like suggesting to workers' comp that I can sit for 3 to 6 hours and I can lift pounds. And I'm like, what, are you not listening to me? I look like I'm active. I am active, and I'm positive, and I'm optimistic, etc.
Yeah. My
life is literally like, be active, lay down, be active, lay down, be active, lay down on ice.
Yeah.
Be active, stop, use narcotics and marijuana and anything to like stop the pain when I stop being active, like it's, and so I feel like, I think this is like brain body, but I'm going to go in there and I feel like they're gonna be like, well, then go back to work. And I got to be able to sit to work.
Yeah, they don't understand it.
I know it's in my head and I want to fix it in my head.
Yeah.
But it feels like if there was like a reason for them to believe besides just.
Yeah, I hear you, my friend. Okay, I get it. Well, first things first, like, I have to say thank you for just being vulnerable, because I know this is vulnerable. Okay. So thank you for that. And nobody here is going to judge you for that, right? So just know that. Okay, I appreciate it. So now the question becomes is, yeah, I mean, it's definitely easier to, especially in modern medicine, when people don't kind of get this stuff, right? They only see things one way, to be like, well, if we can't find anything wrong with Meric, then Meric's making this up, or whatever, however the terms they want to say to make you feel like that, because they generally don't have a good way of describing it otherwise. She doesn't qualify. There's nothing wrong. There is, it's real, my friend. So just know that it's real. What you're going through is very real. All right. Now, do I have imaging to suggest that it's structural or not or whatever? No, I don't. All I have is my silly little evidence list, right? Right. And all my experience doing it. So then the question becomes is like, and this is where I just want to help you out and be a resource. It's like, gosh, how can I help you with that? Right. Like when I think about trying to control the controllables, right, and do what we can with what we've got, it's like, what can we do with this kind of workers' comp thing, I don't know, looming over our head, knowing that we only have so much control over what they're going to think or say or do or whatever. How do we, I don't want to say cope with that, right? But like, it is something that needs to be managed, because it's not just going to go away, right? I mean, you still have follow-ups with them, like you still are in communication with them, right?
Yeah, every month for 3 to 5 minutes of just quizzing me on
I get it, yeah.
same,
Yeah.
better, worse,
Like I just did. I
do routine
apologize.
stuff. Yeah, exactly. No, I'm just
I get
being
it.
like honest
Yeah,
with
yeah,
this,
it's good.
just you, like it's this whole process. I've already actually considered, no, I plan on going in there and telling him my honest journey. Like,
Yeah.
I've been upfront with the doctors every month too. Like, but it's like, well, what help can you give me if it's trauma related? And if it's, like they they don't know. There's not, there's,
Yeah.
no, I don't know what the verdict is going to be of me going in there with my truth of there's this physical stuff that I can do in the moment and pay for it afterwards with that searing, burning pain that wants me just to.
Yeah. What is the biggest fear with the workers' comp thing?
That they're going to say, we're cutting you off of your lost wages and your benefits. And I'm going to be, okay, well then what job can I work in my physical ability right now?
Okay. Yep. And maybe, and let me ask you this, do you really not want the imaging? This is just a quick question here, just to see. Is it that you really truthfully don't want the imaging, or are you worried the imaging won't show a difference and then they'll cut you off because they'll say, see, there's nothing?
No, I feel like I would have better chances of the imaging. I don't know. That's a good question. I guess I just I don't want them trying to fix something with another procedure or another injection. That's more of my fear with the imaging.
Mm-hmm.
But I know I'm divided, because then on the other hand, it's like, well, then there is like proof that there's still something like going on, and that's not just in my head. So I don't know.
All right, so hopefully that video gives you an eye into the types of transformations that can be had inside, again, of the private Glute Relief Accelerator Program that we've created to teach people like you with unresolved back, butt, and sciatic problems who really feel stuck, what they need to do, what people like you need to do to resolve your pain naturally, not having to rely on other people like Meric did for so long. And you can see there were many obstacles that kept Meric from healing, but look at that mess back there, by the way. But with some tough love, with some coaching, right, that was really able to highlight some of the inconsistencies in her story and, challenge her belief system, she was able to get unstuck. She was able to move past a lot of what she had been told and, break through some of these big barriers and get massive results. Again, she came into the program, challenged us, was a bit resistant and sticky, if you will, a challenging case, but she kept her mind open. She kept her eyes open for a new way out, because she really needed to resolve this pain and was just, accepting of the coaching, if you will, and in doing so was able to have some massive breakthrough. So if you have some type of back, butt, or sciatica problem, you've tried lots of different stuff, and or you just want to get right to the source. You don't want to screw around with, trying a bunch of different stretches and going here and going there, and you just want somebody to synthesize everything that is out there as it relates to the treatment of these conditions, and does so in a way that gives you the powers, the tools, the knowledge, the understanding, and yes, the coaching, as you saw in Meric's case, to resolve your pain naturally, then we would love to chat with you. We would love to review your case and see if we can help you out. Links to apply for the Glute Relief Accelerator Program and submit your case review, I review all cases personally, are below in the comments section, as well as the description. So hopefully this video was impactful and eye-opening for you if you've been stuck in pain. So let me know your thoughts in the comments. Thanks so much for checking this out.